Governor. Welcome to the Reggie Lewis. The podium is yours.
Thank you. Thanks very much, and just let me start by thanking the folks at CIC Health for walking the Lieutenant Governor and myself and Secretary Sutters around this facility today. And I want to thank you, Valerie, for you and the team for hosting us here, both starting with the City of Boston and now with this mass vaccination site. We're obviously thrilled to be here today and to have a chance to tour the site. And before I get into some of the details of that, I do want to give a quick update on the COVID numbers. Yesterday, the Department of Public Health reported 1,413 new cases out of about 94,000 tests. 689 individuals are currently in the hospital being treated for COVID, and 183 are in the ICU. The 7-day average positivity test rate for COVID in Massachusetts has dropped to about 1.77%. We're clearly making progress on driving down the rates of COVID here in Massachusetts, and as of today, there are only 14 communities that are designated as high-risk communities. That's down from over 230 back in the beginning of January. And on vaccines, over 2.2 million total doses have been administered here, including 1.5 million first doses of Moderna and Pfizer, and 32,706 J&J doses, and almost 785,000 people in Massachusetts have been fully vaccinated at this point. We remain a national leader in getting first doses and total doses to our residents. We're #1 per capita in the country among the 25 states that have more than 5 million residents for both first dose percentage of the population and for total doses administered. And we're #3 in the percentage of our black residents with at least one dose. We first dosed 74% of our individuals that are over the age of 75, and almost half of those over the age of 65 have received at least one dose as well. Sites like this one here at the Reggie Lewis Center are doing a terrific job of delivering vaccines safely and effectively and efficiently to people here in Massachusetts. Before it became a mass vac site, the state collaborated with the City of Boston to open the Reggie Lewis Center as a community vaccination program. And I want to thank the folks from the Boston Public Health Commission for all their work, not just in setting this site up, but in working day to day, hand in hand with us for over a year here as we have all battled COVID-19 in the City of Boston and across the Commonwealth. The Reggie Lewis Center obviously is a known community location. It's a place the Lieutenant Governor and I have been many times for a variety of events over the years. Isn't this where Tony Richards' dad's basketball program operates out of? Yeah. And over 13,000 people so far have been vaccinated here since the beginning of this process. Current capacity, as the folks at CIC Health said, is around 1,200 appointments, which we expect will get over 2,100s on weekdays and hopefully over about 1,700 on weekends starting next week. The location provides a unique opportunity to do targeted outreach to surrounding neighborhoods, which include communities that have been hit hardest by COVID-19. And half of all the new vaccination appointments that are released each Thursday are reserved here for local residents to ensure that they have access to vaccinations. And as part of the Commonwealth's Vaccine Equity Initiative, CIC Health, along with the City of Boston and many, many other community-based organizations, have been working collectively, as Atul talked about, on a robust outreach operation, which includes a canvassing program to disseminate printed information materials in multiple languages. And with these partners, CIC Health also mobilized a phone bank, which was in operation before, but not now, which has booked over 1,000 appointments for local residents on outbound calls. We're continuing to make progress in reaching communities of color to increase awareness of and access to the vaccine. And places like this, which vaccinates among the highest proportion of Black and Hispanic individuals among our mass vaccination sites, is a great example of that. We've also launched Trust the Facts, Get the Vax, which is a public awareness campaign which began last month, and the Department of Public Health is currently working with Archipelago Strategies Group and Healthcare for All on targeted outreach efforts in 20 of the most disproportionately affected communities. Among other things, that will involve hundreds of thousands of personal door knocks, probably done in most cases by people from the community, to encourage folks to get vaccinated and to provide whatever support they might need to get to wherever they need to go to get vaccines. This morning, 40,000 first dose appointments went online for the mass vaccination sites, and they were booked quickly, and the website worked the way it was supposed to. And this is the last Thursday where the mass vaccination appointments will be made via the VaxFinder website. Tomorrow we launch a new pre-registration system for the state's 7 mass vaccination sites. That includes half of the appointments that get booked here at Reggie Lewis. Eligible residents can visit mass.gov/COVID vaccine to pre-register and to receive a notification when there's an appointment available for them to book. This tool will make the booking process simpler and easier for people, and we plan to add more sites to the pre-registration program in April. If somebody isn't able to use a computer, they can call 211 for assistance in booking an appointment, and once an appointment becomes available, they'll then receive a notification and have 24 hours to accept that appointment. But everybody needs to remember that even if you use the pre-registration system, it could still take several weeks for eligible individuals to receive a notification that there's an appointment available for them. We're still receiving limited doses from the federal government every week, so there are only so many new appointments that can get posted each week. Even if you pre-register, you can still continue to seek appointments at other vaccine locations. So I'll remember there's about 170 sites across the Commonwealth that are open to all groups that are currently eligible. Overall, there will be thousands of appointments available over the course of the next week. The Commonwealth receives about 250,000 first and second doses each week from the federal government, and the mass vaccination sites will administer about 83,000 doses across first and second appointments. Local boards of health and regional collaboratives will receive about 63,000 doses. Community health centers, healthcare providers, and hospitals will receive about 80,000 doses. And the federal government will continue to provide doses directly through its retail pharmacy program to CVS. And this week, we expect that they will receive about 95,000 doses that can be booked for appointments in that program. We obviously have a lot more capacity to administer doses than we currently receive each week. At least 2 or 3 times the capacity that we receive each week from the federal government, and we certainly hope and anticipate that the game will change with respect to supply sometime in the not-too-distant future. Today also marks the first day that K-12 educators, K-12 school staff, and early education workers are eligible for the vaccine. This eligibility group can get a vaccine at any of those 170 sites that are now open to the public. Yesterday, we announced 4 days that are being designated at the 7 mass vac sites, where appointments will only be offered to K-12 educators, K-12 school staff, and child care workers. Those dates are Saturday, March 27th, Saturday, April 3rd, Saturday, April 10th, and Sunday, April 11th. To sign up on one of those dates, educators should use the pre-registration system that's launching tomorrow and attest that they are a K-12 educator, a K-12 school staff member, or a child care worker. And other providers are encouraged but not required to also restrict appointments on these dates to the same groups as well. As I said before, we continue to be a national leader in our ability to get vaccines safely, effectively, efficiently, and equitably to our residents. But this program cannot move fast enough, and people that are eligible haven't been able to book an appointment so far are obviously disappointed and frustrated by that fact. We've taken a number of steps to make the process of booking an appointment simpler, and the pre-registration form in particular will certainly help streamline that process. But in the end, how fast we can deliver vaccines depends on how quickly the federal government can ramp up its production program and its distribution plan. And it could still take several weeks for folks to secure an appointment even after they register. We obviously appreciate the patience our residents have shown with respect to this process, and everyone who wants a vaccine will ultimately get one. And I would just remind everybody that we still have dosed so far 2.3 million doses across the Commonwealth, and at this point, more than 785,000 people are fully vaccinated. We are making progress on this. We certainly hope that federal supply dramatically improves sooner rather than later, because as I said, we have a ton more capacity to deliver vaccine than we actually have supply at this point in time.